Hey everybody, it's low carb and keto nutrition specialist Amy Berger bringing you the one and only keto without the crazy. Just a quick reminder that I have slots open for private consultations. If you would be interested in a one-on-one consultation to troubleshoot your low carb or keto diet, click the link below. Not just troubleshooting, if you're brand new to keto and you are overwhelmed and have no idea where to start or how to do this without losing your mind or going bankrupt, consider booking a consultation. You can also check out the new tiers I have on Patreon, patreon.com/2itnutrition. There's also a link down there. That's another way that you can get lots of live time with me for Q&A, for help troubleshooting, for all that good stuff. All right, let's get into the topic. Let's talk about normal on lab tests. And I do have some notes and I have some little goodies. Let me just start off by saying that this video, this topic, was inspired by an experience I had about 2 weeks ago. I donated blood at the Red Cross. And I donate blood regularly. I've been donating for years and years. And it's actually a really funny story how I got started donating, and I'll share it with you because you will get a kick out of it, I think, since you only know me as a low-carb keto kind of person, right? The very, very first time I ever donated blood, I was in college. And the reason I did it was because they were offering, as a little incentive, they were offering a $10 gift certificate to my favorite restaurant I went to college in Pittsburgh, Pennsylvania. And if you donated blood, you would get a $10 gift certificate to this one restaurant. And I loved this restaurant, and I used to always get a spicy chicken sandwich. And no, I'm not talking about Wendy's, but they had a really delicious spicy chicken sandwich with seasoned fries that were really salty and peppery. And of course, I got it with a Diet Coke. Anyway, that was back pre low carb Amy Berger. But in all the years I've been donating blood on a low carb or keto diet, I have never ever needed to consume the juice or cookies or crackers or whatever else they have in the canteen. If you've ever donated blood, you know, after you give your pint of blood, you have to go into their little canteen waiting area to make sure that you're okay. They don't want you getting behind the wheel of your car and passing out or having some kind of problem. So you have to sit there for a little bit just to make sure you're okay before you leave. And in this waiting area, it is typically stocked with juice and soda and cookies and crackers and candy, and I've just never needed any of that. And I think it's because when my body is not dependent on glucose and not dependent on like constant infusions of glucose via food or drink or whatever, then when I'm down a pint of blood and whatever glucose was in there is gone, my body's not in crisis. My body's not, oh, must replace lost glucose, must have crackers, must drink grape juice. I just sit there. Sometimes I have water. Most of the time I just sit there for 10 or 15 minutes and then I get up and leave. So, I think that's pretty odd, right? It's not normal. Most people who donate blood have cookies and juice. Whether or not they need it, it's just the norm for them to have it. And I wonder, it can't be all that abnormal for someone to skip that, because I've never had a volunteer in that Red Cross canteen freak out or be like, what? You're not going to have the candy? You have to have something. No one's ever said that. So there must be other people who don't do it. And I imagine not everybody who goes through the Red Cross is on a low carb diet, you know, to donate blood. But anyway, just saying, normally people have the candy and the sugar. So what my friend Dr. Westman, my co-author on the book End Your Carb Confusion, has been saying for a while now that we might need a keto normal. We might need new or alternative normal ranges for certain things on blood tests for people on a low carb or keto diet. And to be clear, there are going to be certain things in standard routine blood work that are just where they need to be for every human. And most of those are going to be things like your electrolytes, your calcium, your magnesium, potassium, sodium, chloride, all that stuff. The human body just keeps all of those within a really, really tight, narrow range. there's going to be other things that are diet dependent. And what's normal for a population and for people that eat 50% carbohydrate or more in their diet may not be normal for somebody who's eating 15 or 10 or 5% carbohydrate or 0% carbohydrate for you carnivores out there, or as close to zero as you can get. It is entirely reasonable to me anyway that, again, what is normal under one context, one dietary circumstance, may not be normal for another. So let me consult the notes here so I don't forget everything. Yeah, all of those normal ranges were established in people eating what we call a mixed diet, meaning mixed carbohydrate, protein, and fat, erring on the side of higher carbohydrate usually. So all of those normal ranges are under the assumption that somebody's eating a very large percentage of their calories or their food from carbohydrate. So just to think of what's normal, if somebody's not on a ketogenic diet, it's not normal for them to have acetoacetate in their urine. It's not normal to have measurable ketones in your urine. It's not normal to have elevated ketones in your blood if you're not on a ketogenic diet. You might have a very, very trace amount. You know, even people not on keto diets, people that are very healthy, very metabolically flexible, and very active, will have a little bit of ketones now and then, not like somebody on an actual ketogenic diet. You know, and even another example, well, let me follow the notes here. Like another example, those of you that have worn a CGM, a continuous glucose monitor. I wore one maybe last year, 2 years ago as an experiment just to see what was going on. And it wasn't abnormal for me to, and for anyone really on a low carb or keto diet. I don't think it's abnormal to see blood glucose in the 60s or 70s. I mean, mostly you'll be within like 70s to 90s, you know, low 100s, but that's not abnormal. But if you have type 2 diabetes, you might see a blood sugar of 65 and worry that you're in danger, that's hypoglycemia. 65, and I'm talking milligrams per deciliter, that is a perfectly normal blood sugar. You're just so accustomed to being so much higher that you worry that something's wrong when you're that low. And I actually did take the time to do some of the conversions. So for somebody on a low carb keto diet, seeing blood sugar, like I said, in the 60s or 70s milligrams per deciliter is normal. That's not low, in my opinion. And for you millimolar people outside the US, that would be 3.4 to 4.2-ish millimolar, like that range, 3.4 to 4.2. But again, if you have type 2 diabetes, seeing numbers more like 180 milligrams per deciliter, or that's 10 millimolar, seeing 220 milligrams per deciliter, or 12.2 millimolar. Some of you, if you had really, really poorly controlled diabetes, you might have seen 300 milligrams per deciliter, or 16.7 millimolar. So, and those aren't normal, but they're not uncommon for somebody with poorly controlled diabetes. So normal, and I think most healthy people eating a mixed higher carb diet probably won't see 60s and 70s all that much, unless they might be getting hypoglycemic because they're just crashing. Let me not confuse people with that rabbit hole for a second, but let me take a step back and talk about like how I said, normal is context dependent. Normal on a high carb diet versus normal on a very, very low carb or keto diet. I studied Korean when I was in the US Air Force. For those of you who don't know, I was in the Air Force for this much time, really briefly. But I studied the Korean language. I was a linguist. And so I learned to speak Korean, and we learned a lot about the culture as well. And I think this is changing now, but in the past, traditionally, the normal funeral color in Korea, in South Korea, was white. They wear white to funerals. That's how they show mourning. That's how they pay their respect to someone who has died. So in South Korea, wearing white to a funeral is normal. In the US, that's kind of an insult. There's something is wrong unless the family has said, hey, everybody, it's okay to wear white. We all wear black, or we wear a dark, subdued color to funerals. In the US, black is normal for funerals. Korea, white was normal. What about a job? The attire, the sort of dress code for a job depends on the job, right? What is normal for a lawyer to wear while they're arguing a case in front of a jury is very different attire from what's normal for a plumber to wear to come unclog your toilet. And I'm pointing that way because my bathroom's over there. What's normal for Amy Berger to wear while she's sitting in front of her computer writing an article is different from what's normal for a brain surgeon to wear while she's in the operating room cutting into somebody's skull. So what's normal depends on the situation. And so I just think that what's normal for someone on a low-carb keto diet may be different from the context of what's normal for somebody on a very high-carb diet. So another really great example, I think, is triglycerides. Again, in the US, I think they like for triglycerides to be under 150 milligrams per deciliter. That's about 1.7 millimolar, if I've done all the conversions correctly, or if the websites I used did the conversions correctly. You want to be 150 milligrams per deciliter or lower, or that's 1.7 millimole per liter or lower. But again, on a keto diet, and on a keto diet, it's not abnormal to be in the 30s. My triglycerides were 33 once, 33 milligrams per deciliter. So we're talking about, that's 35 milligrams per deciliter, 0.4 millimoles per liter. Or to have triglycerides of 45 even, which is 0.5 millimoles. That's totally normal on keto. And it might even be normal for a very, very healthy person who's on a regular diet. But if you're on a keto diet, if your triglycerides are kind of on the high side, maybe mid 100s, somebody would probably ask, are you actually sticking to the diet? Like, are you having trouble? Are you kind of like getting into the carbs every now and then? Because what I would expect on a keto diet is going to be on the lower side. So, yeah. And it's not, like I just think it's normal to see someone on a keto diet with triglycerides that are nowhere near 1.7, that are nowhere near 150 milligrams per deciliter. And let's talk about insulin. Insulin is a great example too. Most labs in the US will tell you that for fasting insulin, and I'm not talking glucose, I'm talking insulin, fasting insulin, they like to see it, or not like to see it, normal would be under 20, I think it's milli-international units per milliliter, or it's micro-international units per milliliter, or under 25 micro-international units per milliliter. And that, for you picomole per liter people outside the US, that would be under about 174 picomoles per liter, or under about 139 picomoles per liter. In the keto world, we would say that is way too high. That's not normal for someone on a ketogenic diet. For someone on a very low carb or ketogenic diet, a normal insulin level is going to be far lower than that. It's going to be more like 5 micro-international units per milliliter, or 35 picomoles per liter. It's going to be more like 2 or 3 micro-international units per milliliter, or 14 to 21 picomoles per liter. We like to see it. I am not a doctor. Everyone knows this isn't medical advice, but my conversations with doctors, listening to their talks and everything, on a keto diet, we like to see insulin under 10 fasting insulin anyway. We like to see it under 10 micro-international units per mil, or that's about 69 picomoles per liter. It's okay if it's a little higher here and there, especially if you're on keto and you're sort of still in the process, if you still have some weight to lose, or you are in the process of improving your diabetes, improving your metabolic condition. Just remember, if you ever get fasting insulin tested, because it's not a common thing to do, although I think it should be, if you've never had your fasting insulin measured before, you have nothing to compare it to in the past. So let's say it is 20 micro-international units. Let's say it is 139 picomoles or more. You might that might already be a massive improvement from where it was 6 months before you started keto or a year before. We don't have a data point from the past to compare to. So just my point is, never become alarmed by any one measurement all by itself in isolation, whether that's triglycerides or glucose or insulin or anything. Always look at the total picture, and of course, you would work with your doctor to interpret your bloods anyway. But speaking of that, speaking of the work with your doctor, I do want to put in a little plug for two of my friends that just wrote a book together called Common Sense Labs, or maybe it's called Common Sense Lab Tests. Let me double check. Common Sense Labs. And you can buy it at commonsenselabsbook.com. And this is not a paid advertisement. I'm not an affiliate. I don't make a dime if I promote their book. It's written by Dr. Ken Berry and Kim Howerton. And I know both of these people personally. They both do great work. I haven't read the book yet, so I cannot vouch for it personally, but I trust the work of these two people. I trust that anything they put out is not only going to be good, reliable, trustworthy, science-based, well-referenced, but readable, plain English for people that just want to make sense of their lab tests. They don't, not something you need a PhD to understand and comprehend. That is commonsenselabsbook.com, because you should be able to make sense of your own labs. With physician guidance, yes, but it's your body. Nobody cares about your health and your body more than you. I don't care how good your doctor is, how loving, how caring, how attentive. They don't care about you and your health more than you do. So, and you have a right to understand what those numbers mean, what the ranges should be. But since I'm saying what the ranges should be, let's go back to the beginning and sum up. I think that it's not unreasonable to speculate that some of these normal ranges or the reference ranges might be different in somebody on a lower carb or keto diet. You know, and another example is the BUN, the blood urea nitrogen. In some people that eat higher protein diets, the BUN can be elevated, or the BUN to creatinine ratio can be elevated. It's not going to be like off the charts elevated, but it might be a little bit out of the range. It might be a little above the high end of the range. Most of the doctors I know don't consider this a problem if they know you are eating a high protein diet. So just something to keep in mind, that all of these ranges are based on people who eat a fair amount of carbohydrate. And just to reiterate, I'm not suggesting that no lab range is reliable. Like, I do think there are definitely some of those parameters that any healthy human, regardless of what they eat, should fall within. And if you don't, you're going to have some problems. But I do think especially some of these metabolic parameters, like the triglycerides, the fasting insulin, glucose in general, what else could I say? Even cholesterol, but that's a whole different topic, right? Where most people who go on a low carb or keto diet have their total cholesterol and LDL decrease. Some people it increases a little bit. Some people it increases a ton. Some people it increases while they're in the process of losing weight, and once their weight normalizes and they're at a stable weight for a while, the cholesterol actually comes down and sort of stays at a stable level. That Dr. Finney, the great Stephen Finney, wrote a paper about that, I don't know, 20 years ago or so, something about the transient hypercholesterolemia of weight loss. And what does that mean in plain English? It means that when some people lose weight, they temporarily have higher cholesterol. Transient, temporary, hypercholesterolemia, higher cholesterol during weight loss. Many doctors don't know that. Many doctors are not aware that that is something that happens. And this is why we get a lot of people on keto diets whose doctors freak out that their cholesterol went up. Well, yeah, you just lost 50 pounds over the last 6 months. I'm not shocked that the cholesterol is up. But cholesterol is a whole different set of videos, isn't it? I will point out, though, I'm going to put a link below. I authored a paper with a cardiologist. His name is Eric Thorne. He's out of Arlington, Virginia. We wrote a paper together about the cardiovascular benefits of low carb and keto diets, all of the good things that happen for cardiovascular health and function on a low carb or keto diet. And we did address, oh, what do we do if the LDL is up? So I will put a link to that paper. It's the open access full text. When you click on that link, if you want to read the whole paper, I think there's a tab that says download PDF or download full text, something like that. That's how you can read the entire paper for free. And I will link to another paper by David Diamond, PhD, co-written with Ben Bikman. Many of you know him, and I think Paul Mason, if I recall correctly. Dr. Mason, Ben Bikman, PhD, and David Diamond, PhD, wrote a paper that basically makes the case that statin drugs, the drugs to lower cholesterol, are not warranted for people on low carb diets who have very, very high LDL, but all the other stuff is fabulous. The fasting glucose is great. The insulin is great. The waist circumference is great. Triglycerides are low. HDL is higher. Inflammatory markers are low. When everything looks great, but the LDL is high, those people do not need a statin according to that paper. I'm not telling you what Amy Berger thinks, because Amy Berger's not a doctor and she's not going to give you medical advice, but she will link to those two papers so you can read them and make your own decisions. But let me just check the notes, make sure I haven't missed anything. Yeah, definitely check out that book, commonsenselabsbook.com. Can't wait to get to it myself. I think it's going to be a really valuable read for those of us that are in this sort of world, this community that care about this stuff. Don't outsource your health. Just because you're not a doctor, just because you're not, a PA or a nurse practitioner or even a nutritionist who has studied some of this, that doesn't mean that you are incapable of interpreting numbers on a page. Do you know what I mean? And with that in mind, hard at work on my thyroid book. My co-author and I have gotten some deadlines in place that I think that's going to be coming along soon, because if there's any area where the normal ranges are not helpful, it's thyroid. But I'm going to finish now. Just something to think about, some sort of interesting food for thought. I think when you stop and think about it, isn't it entirely reasonable that when you eat very, very little carbohydrate and your blood glucose is kind of low normal most of the time, your insulin is low normal most of the time, I think it's actually fairly reasonable that certain things are going to be at different levels than they are in somebody who's on a very high carb diet. That's all I'll say about that. So we may need to change what we think of as normal, or have two different sets of what is considered normal. One for keto people, one for high carb people. And that's not to say that everyone who's eating a high carb diet is going to be unhealthy. Like, all the people who eat high carb diets and remain lean and healthy and everything's great, they probably do have low insulin. They do have low triglycerides. They do have a small to normal waist circumference. All of that stuff is going to be good. But I think that is increasingly rare these days. I think it is very, very rare to come across people who are on a high carb diet that are in truly excellent metabolic health. It's not non-existent. It's just getting more and more rare as we all become sicker and heavier and larger. Thank you for watching. Subscribe to the channel if you haven't already. Check out the Patreon, patreon.com/2itnutrition. And remember, I am open for new consultations. All the links are below. I will see you next time. Thanks for watching.